Uh, I will be presenting my placement report on the challenges faced by the Scotland aging rural population in accessing healthcare services. Uh, the focus of this presentation is not only to highlight the challenges that elderly people in rural Scotland experience, but also to evaluate what Transport Scotland has done so far and to propose the recommendations that can lead to practical and sustainable improvements. This topic is particularly important because transport is often overlooked as a health issue. Yet, for the many older people in rural areas, transport determines whether or not they can even access healthcare in the first place. Uh, just give me a second. Right. Okay. Uh, So, I have structured this presentation into three main sections. First, I will present the challenges that elder rural residents face in accessing healthcare. Second, I will look at the response and initiative already proposed or implemented by the Transport Scotland. Finally, I will outline my recommendation for how access to healthcare and transport could be improved. This will allow us to move from understanding the problems to evaluating current policy and then forward toward the solution. Let me begin by explaining why this issue matter. Why this issue matters. Scotland rural area actually have a higher portion of elderly resident compared to urban areas. According to demographic data, the rural population aged between 65 and over has increased by more than a third in the last 2 decades. These individuals often live longer lives, but they also live with more chronic conditions such as diabetes and the cardiovascular diseases, which required regular medical checkups or medical appointments. However, unlikely the urban counterparts, many rural elderly people do not own a car due to the financial or physical limitations. Uh, this will leave them heavily dependent on public transport, which is often infrequent, indirect, or simply unavailable in many rural communities. Uh, in other words, health need is high, but the transport access is low. This imbalance creates significant inequalities in health outcome between rural and urban Scotland. So now let us look at the key challenges. Now there are five main barriers that constantly emerge in reports and surveys. These are long distance between rural communities and healthcare facilities, limited and infrequent public transport services, high cost of travel, which many older people on fixed income cannot afford, poor physically accessibility. For example, buses that do not accommodate wheelchairs or buses stops without seating. And finally, the digital gaps, which prevent older people from using alternatives such as telehealth or digital booking system. Together, these barriers create a situation where many elderly people are unable to attend the appointments or where the journey itself become a stressful or exhausting process. Uh, then affordability is one of the biggest issues. Research shows that some elderly people have to skip meals in order to afford transport to medical appointments. Even reduced fare are still unaffordable for many pensioners who rely on the fixed incomes. According to the Office of National Statistics House, the nation statistics, household earning less than 15,000 pounds annually report much lower than the satisfaction with their access to hospital. And many of these households are concentrated in rural areas. This demonstration how to transport costs are directly linked with the deprivation and health inequality. In short, even buses exist, many older people simply cannot afford to use them regularly. So my next slide is availability and accessibility. This is another major challenge. Buses service in rural Scotland are often infrequent, running only a few times per day. Routes can be indirect and time consuming, requiring multiple transfer that do not align with the appointment times. For example, an appointment at 9 a.m. may be impossible to reach if the bus does not have arrived until the 11 a.m. Uh, Physical accessibility is often overlooked. Bus stops may lack basic seatings or shelters, and buses may not have adequate facilities of wheelchairs or walking aids. For older people with mobility issues, simply reaching and wait at the bus stop can be extremely difficult. These small details add up to the create a major barrier. So, our next slide is about the health impacts. The transport challenges have significant consequences for the health outcome. Many elderly people report missing or delaying medical appointment because of traveling difficulties. This led to the late diagnosis, poorly managed chronic conditions, and more emergency admission. Beyond Beyond physical health, transport problem also contribute to isolation and loneliness. Older people who cannot travel easily are less able to attend the community events or even visit family and or some friend. This lack of social contact has shown to increase the depression and reduce all our overall the well-being. Poor transport not only affects healthcare access, but it undermines mental health, independency, and quality and the quality of life. So the so current n- so uh, Now, the current responses to what Transport Scotland has done so far, several initiatives have been introduced to address the transport barriers. The first is the Transport to Health Delivery Plan, which seeks to coordinate transport services with healthcare needs. The second is to accessible travel framework, which promote collaboration between the NHS and local authorities and transport providers. Other measures include community transport scheme and the provision of free bus passes for people over 60. These initiatives shows that the problem is recognized at a policy level. However, many of these measures remains fragmented and underfunded and do not fully meet the needs of the elderly rural population. So, in the community transport and volunteers, voluntary community transport and volunteers schemes deserve special mention. During the COVID-19 pandemic, voluntary drives provide free trips to vaccination centers, which proved to be provided free trips to vaccination, which proved to be lifeline for many elderly patients. Community transport continue to play an important role, especially where buses services are unavailable. These schemes are heavily reliant on volunteer, face high demand, and often lack funding. Moreover, the national bus passes scheme does not apply to community transport, meaning elderly people still have to pay. So while community transport fills an important gap, it is not a sustainable for fully accessible solution under the current arrangements. So So, uh, in this light, digital health service, the the pandemic also highlighted the potential of digital health services. Telehealth consultation via phone or video can reduce the need of travel, particularly for the routine appointment. This can be valuable tool for rural areas. The rollout of telehealth has been uneven, poor broadband coverage, weak mobile signal, and lack of digital uh, lack of digital broadband coverage. Uh, Many elderly patients are unfamiliar with using apps or online booking system, and some do not even have on their smartphones or tablets. So while digital solutions have potential, they cannot yet replace physical transport for most elderly patients. So, this brings to my recommendation based on the evidence. I proposed a comprehensive strategy with five key elements: integrating transport plan into the healthcare system, strengthening community transport, and expanding concessions, expanding virtual health service with better broadband and training. And the fourth one is developing digital journey planning tools to help patients plan their travel, and finally providing community-based mobile health service to bring healthcare closer to people. These recommendations are designed to complement existing initiative while filling the gaps that are currently exist. So, my first recommendation is to integrate transport into the healthcare planning. This means NHS appointment system should be coordinated with bus and transport timetables, ensuring that the people can realistically attend the appointments. It also means joint budgeting between the health boards, ambulance services, local authorities, and transport providers. This kind of integration has already been recommended by the Mobility and Access Committee for Scotland, and could significantly reduce missed appointment by aligning transport availability with healthcare demand. And my second recommendation is the strengthening community transport. This include increasing the fundings, providing grants to the local providers, and training volunteer drivers, and free bus parts should be valid on community transport services, not just on public buses. Uh, Medical taxi schemes could be subsidized so that the elderly patient can afford them. Partnership between the government and local taxis companies could ensure reduced fare for medical trips, filling the gaps which buses do not operate. So my third recommendation is to expand the telehealth service. This requires investment in rural broadband infrastructure, as well as the provision of devices such as tablets to the elderly patients who need them. Uh, Equally important is the training. Both patient and healthcare staff need to feel confident using telehealth platforms with proper support. Telehealth can reduce unnecessary travel, free up transport capacity, and improve access to care for those with limited mobility. Uh, so my fourth recommendation is to bring the healthcare to people through mobile and local services. This could include the mobile clinics that visit remote villages on scheduled days, and local health hubs where nurses, practitioners, or doctors provide basic checkups. These hubs could also be equipped with teleconsultation facilities, so patients can connect with the specialist without traveling a long distance. This community-based approach reduces the reliance on the transport and make healthcare more accessible. Uh, uh, while implementing these recommendations would lead to several positive outcomes. Firstly, there would be a significant reduction in missed appointment, saving cost of NHS and improving patient care. Secondly, better access would allow for earlier treatment that improve management for chronic conditions. Thirdly, the greater mobility and connectivity would reduce the isolation and uh, improve the mental health. And finally, these changes would yield cost savings as preventing the health as far as less expensive than treating emergency. In short, investigating in transport is both a moral responsibility and an economic necessity. So, at last is my conclusion. Uh, Transport is a health issue for many elderly people in Scotland. Poor transport is a single best barrier to accessing the healthcare. While Transport Scotland has introduced some positive initiative, these remains fragmented and insufficient. What is the need of the coordinated multi-sector approach that integrate transport with healthcare, strengths community-based services, and embrace digital solutions where possible? By doing so, we can ensure that elderly rural residents are not forced to choose between missing meals and missing medical appointment. Instead, they can enjoy the equitably access to the healthcare they need. Uh, here is my the post made for the social media which summarized this report. And at last, thank you very much for your time and attention. I would be happy to take any questions.
Thank you very much, Abdul, for talking about that important topic around transport and healthcare access.